Hey there, my name is Dr. David St. Jean, and I wanted to thank you for tuning in to our website. My functional medicine and clinical nutrition practice is really an outgrowth of the increasing need for natural healthcare solutions, which I think has become quite evident, I would say, throughout our country. I practice as a physician, an author, researcher, and a health enthusiast. And after graduating from school, my goal was to treat every condition, know everything about anything that had to do with medicine, a classic new graduate perspective. As you can imagine, after acquiring real-world experience and further solidifying my clinical approach, I soon realized that this was not a very realistic ambition. See, your body is extremely complex, and honoring this complexity, I decided instead of being a jack of all trades and a master of none, to focus in on certain conditions. Conditions which not only I'm extremely passionate about treating, but also ones that for some reason I seem to get really good, consistent results with. So specializing in functional medicine is surely one thing, and that's awesome, but I've decided to take it a step further and hone my skill set on specific chronic degenerative conditions. I often think about it like this: if my wife or my mother, my father, or best friend was suffering, I'd want to make sure the individual they are working with is extremely well versed on the topic to ensure the best quality care for my loved ones. You know, you have one life and one body. It's not something we can easily replace. Finding a practitioner who knows the subject inside and out is imperative. So I've found the more a physician knows, usually the more humble that practitioner becomes, and this really enhances their ability to discern whether or not they can help you. When is it time to refer, and exactly what you need in terms of treatment. And also be the first to say there's a fine line with specializing. I believe the key is not to be so specialized that you develop a narrow or rigid lens. You always have to stay open-minded and look at the whole entire body, not just one little part. This is probably one of the big differences between my practice and most other specialty clinics that you'll see, and again, that is perspective. I refuse to run protocols like most other functional medicine doctors will do. That one-size-fits-all model, you know exactly what I'm talking about, where everyone with Hashimoto's or menopausal symptoms gets the same exact treatment. I instead try to focus on understanding the principles underlying your health condition, which allows me to apply and tailor corrective treatments that are specifically meeting your individual needs. And with that said, my approach to evaluation and treatment is eclectic. I utilize several different whole body based interventions or several different tools in my toolbox, depending on what you, the person in front of me, needs. And this integrative approach to your health is what I feel sets our care apart from most others. My main goal is to get you better with practical, effective, and non-invasive programs. I only implement scientifically backed, clinically sound, and research-driven therapeutic interventions. As you can probably see from our website, I treat a few conditions. Digestive and gut health usually ends up being SIBO and IBS, adrenal fatigue, fertility issues, thyroid dysfunction, and female hormone imbalances. So if you or a loved one are suffering from, or maybe you're just looking to find more information on these conditions, check out our video and article blogs. There is a ton of information for you to read through and to watch. You know, empowering yourself with knowledge is really the first step to recovering your health. And so go get started. And thanks for watching. This is Dr. St. Jean, and I'll see you next time. Bye-bye.